各位記者朋友，多謝大家今日嚟呢個記者會。
Welcome to the press conference. The Chief Executive and her team will first speak before we open up for questions. Chief Executive, please. Friends from the media, members of the public, today marks the 4th day of Lunar New Year and also the final day in the current public holiday. Together with 8 members of my team, I'd like to report the latest work of the government, as well as additional measures we installed in face of the new strain of coronavirus. The command center, which I preside over, has started work for the 3rd straight day since we elevated the response level from serious to urgent. In the last 3 days, we have convened meetings at the steering committee. Like I said last time, epidemic control requires the efforts of the entire society, and I hope everyone would chip in with their efforts. Since we entered the alert level in the beginning of the month, our staff has worked tirelessly, including the Port Health Division of the Center of Health Safety, as well as HA frontline staff at different clinics at hospitals. They have worked very hard, and this also includes staff in the government laboratory, etc. I'd like to thank them all for their efforts. The ultimate aim of the disease or epidemic control work is to safeguard public health. And with this, it is unfortunate that a lot of fake rumors and fake news were circulated online in recent days, and these would seriously affect our epidemic control efforts and create undue fear, and ultimately the public would suffer. On Tuesday, that is yesterday, there were posts online spreading false rumors that alleging that myself as Chief Executive is using Hong Kong's healthcare system to help deal with the epidemic on the mainland. Such rumors were ungrounded or absurd. Everyone would understand that it is not possible for Hong Kong's healthcare system to fulfill this goal. So you can imagine what the intents behind spreading these rumors are. In face of the aggravating epidemic, such rumors are making our work even more difficult. Apart from establishing new measures, we must also spare time monitoring these news and information online, so our resources would be spread thin. So once again, I strongly condemn individuals who spread such fake rumors, and I urge the public not to blindly trust such information, and the government will disseminate the latest information on our websites. The epidemic has developed rapidly, and as such, the measures taken by the government must be constantly updated. On a whole, we would rely on the advice of experts as well as scientific data. I'd like to thank the 4 professors on our committee who have contributed to our recent work. And I'd like to talk about additional measures agreed by the steering committee, and there are 7 areas. First of all, one of the keys to controlling the epidemic is to substantially reduce the flow of people between the 2 places. In other words, we are not just talking about mainland visitors to Hong Kong, but also Hong Kong travelers to the mainland. And the number of commuters must reduce substantially both ways. There are 14 boundary control points in Hong Kong, and from the 1st to 26th of the month, Hong Kong residents make up 67% of the total number of commuters and 26% for mainland visitors. The rest are other nationals. And on the 25th and 26th of January, and with certain outbound travel restrictions installed in the mainland and the cancellation of many mainland tour groups, on the 25th and 26th, the percentage of Hong Kong residents increased to 74% of the total number of travelers. In other words, three quarters of all commuters at our borders are Hong Kong residents. And given the gravity of the epidemic, to further reduce the flow of people between the 2 places and reduce unnecessary commutes, we are installing the following measures. Number 1, we would have to tackle the problem at source, and with the endorsement of the central government, the mainland would stop issuing individual traveler endorsements to cover more than 40 countries. According to statistics last year, travelers on IVS made up about 50% of all inbound visitors to Hong Kong. So by suspending the issuing of the endorsements, the number of inbound travelers from the mainland can be substantially reduced, and the inbound tour groups make up about 20% of the inbound travelers. So the rest would be business travelers, those visiting relatives. They make up 20% of all inbound visitors from the mainland. So the measure will be effective in reducing the number of visitors from the mainland. Secondly, since transportation services are required for the commuters, we would scale back our transportation services. First of all, for the XRL line at West Kowloon and all intercity train service at Hong Kong Station will be suspended. In terms of air travel, the number of flights from the mainland to Hong Kong would be slashed by half. In terms of sea travel, and all cross-border ferry services at Tuen Mun Pier and the China-Hong Kong Pier would be suspended. As for cross-boundary coach service, those at the Hong Kong Zhuhai Macau Bridge and Shuttlecock would be suspended. So this is a measure to scale back various transport services. Number 3, we would suspend services at certain boundary crossing points, and the ports affected, or the ports to be closed down temporarily, would be the West Kowloon XRL station, the Hong Kong Station port, Shuttlecock, and Meng To. While passenger services at these 2 ports would be suspended. For China Ferry Terminal and Tuen Mun Passenger Terminal, the ports would be suspended, and freight travel would not be affected, and the effective date would be from the 30th of January from 12 midnight. Today is the 28th of January, and the measure would be enforced until further notice. And one additional benefit to the suspension of BCP services is that we can focus our manpower on the operating pods so that we can enhance the surveillance and temperature screening of passengers. In this regard, I'd like to thank the support of the central government as well as the cooperation of relevant authorities. I had a telephone conversation with the governor of Guangdong province, and I understand that officials from both places are working day and night to install the relevant transportation measures.
或者嚟到
Another measure to reduce the people flow between the two places is to have the joint efforts in prevention and control of the outbreak. You probably have heard that in Mainland at the major ports in Shenzhen, they have implemented the outbound travelers health declaration measure and also the temperature screening. On our part, we will tie in with that. At the BCPs, we will implement these exit screening, including the airport. We will increase the infrared thermal imaging devices. Later on, the Secretary for Food and Health will supplement a bit further on this. The second measure is that in recent times, we've heard comments and concerns regarding the charging on the part of the hospital authority for the NEPs and non-entitled persons, meaning non-Hong Kong residents. If they come into Hong Kong and use the public hospitals services, they will be charged at cost, which is expensive. But under the policy, in order to avoid these infected people from avoiding going to the hospital and therefore spreading the disease to the community, our policy is that for these NEPs that are related to infectious diseases, the charges will be waived. The charging system of the hospital authority is a reflection of this requirement. It is not a policy formulated for this purpose. This has been the policy on the part of the hospital authority. In fact, before the hospital authority was set up, this has been the policy. We are at a time of disease control and prevention. I think it's time for us to adjust this practice in order to take away the incentive for the coronavirus infected people to add burden to the hospital authorities. So with effect from today, for all NEPs, they will be charged accordingly. Third, as we said last time, other than controlling the flow of people between the two places, Hong Kong people should avoid any contacts in order to minimize the possibility of community infection. So the third measure is to reduce the contacts between people. Other than suspending classes and the suspension of the major events, I'd like to make these pleas. First, Hong Kong people should come back to Hong Kong from the mainland. Anybody coming back from the mainland should stay at home for 14 days. If they have to go out, they have to wear face masks. I'd like to urge the people of Hong Kong not to travel to places that are infected. Since classes have been suspended, one should not take vacation because that would add to the risks. For enterprises, they should exercise flexibility. As far as civil servants are concerned, we've made the announcement this morning that other than the emergency services and also essential public services, civil servants during the Spring Festival can work from home until the 2nd of February, and we will keep this under review. Members of the public can rest assured that the emergency services will be maintained, and there will be an announcement regarding the closure of certain facilities. From last night, the relevant departments have already made the announcement, like the LCSD services, the SWD's subvented institutions, the ENB, and also the AFCD. They have already made the announcements. Other departments will do likewise later on. When taking public transport, we advise the passengers to wear face masks as well. The fourth issue is how we can help the Hong Kong people who are stranded in Hubei province. As of yesterday, the CMAB and also the 5 mainland officers, the Security Bureau or the Immigration Department have received requests for assistance from 107 cases involving 200 people. These 107 cases of requests have to do with the Hubei province. As far as I understand, there are no students. Mainly, the students studying in Hubei province have come back to Hong Kong during the Spring Festival. Because of the suspension of the transport system, they're stranded in the Hubei province. The mainland office has already solicited their information. We're maintaining contact with them. Since transport has already been suspended, we are liaising with the mainland authorities as to how these stranded Hong Kong people can be coming back to Hong Kong by some arrangement. Fifth, Hubei people in Hong Kong. Yesterday, we have already restricted Hubei residents and persons who have visited Hubei province in the past 14 days from entering Hong Kong. Those Hubei people who have already entered Hong Kong, we don't have the precise figures, but there are still quite a certain number. These people can stay in Hong Kong for 7 days. The number is diminishing. However, we will try our very best to get in touch with these people from Hubei province and give them proper health instructions. And through this sector and through the tourism board, we will get in touch with these Hubei people and refer them to the CHP for follow-up. Also, the Education Bureau will be getting in touch with the tertiary institutions. And for the students coming from Hubei, they will also be referred to the CHP for follow-up. For Hong Kong people who visited Hubei province in the past 14 days, they should call the CHP on the hotline. 6. This has also generated some discussion, and that is quarantine facilities. These are they are called the quarantine camps, and they are facilities for isolation. In order to tackle the disease, we do have the obligation to set up these quarantine centers. I must emphasize that those staying in these centers are by no means patients. They are by no means infected people. They are close contacts. They may be healthcare workers who have been serving the infected people who cannot get home. So there is need for these centers. According to our previous practice, other than using the holiday villages, we have limited capacity there. Other than the holiday villages, they will also take advantage of the completed PRH units that are unoccupied. 5-bedding estate in Fanling is considered to be suitable for this option. We regret that the facilities in 5-bedding estate have been severely damaged, and not only can they not be used for this purpose, this will also affect the people who will be assigned to these premises. Having reviewed the extent of the damage, we have decided to give up on the idea of using 5-bedding estate. In the coming year or so, there will be PRH units that will be coming on stream. I must say that these housing estates are not suitable for being used as quarantine centers. So we don't have any plan for the time being to consider using these premises as quarantine centers.
However, it does not mean that we would not do anything. Depending on the development of the epidemic, we would decide on the amounts of quarantine facilities required, so the government will continue to identify suitable venues. And I call for public understanding, since this is part of our control measures. And I hope that NGOs who are deploying these holiday camps would understand the situation, that they could convert some of the holiday camps into quarantine facilities. If eventually inadequate quarantine facilities are identified, the last option would be quarantine at home. So the public must be prepared for this scenario if we could not identify enough quarantine facilities. As for the gear or equipment, money is not an issue. Like myself and the financial secretary indicated, we would certainly not lack the financial means. Even if we are yet to secure the financial funding, we would still provide the resources first. In terms of various supplies, they are rather short, including hand sanitizers and face masks. We are maintaining communication with the trade as well as suppliers. But since we are in a holiday period, it is often difficult to get in touch with suppliers during the New Year period. And as such, some people have rushed to purchase various supplies. But Mr. Yao would explain our efforts of procuring such supplies globally. That's all for my introduction. I would defer to my team before we open up for questions. Professor Sophia Chan, Secretary for Food and Health. Thank you. I'd like to report the latest situation. As at 12 today, there were 8 new cases of imported Wuhan pneumonia cases. There were no new imported cases yesterday, and about 100 patients are currently in quarantine. Of the 100 cases, the CHP is conducting epidemiological studies and also tracing the close contacts of the patients. The CHP will arrange for quarantine for these close contacts and carry out medical surveillance. The MacLehose holiday camp under the LCSD has been converted into a quarantine facility, and currently 31 close contacts have been sent to the holiday camp for quarantine. The CE announced the activation of the urgent response level, and having set up a working group, we convene meetings every single day. And together with the Department of Health and HA, we are deliberating on more effective measures. And we are closely communicating with our experts to take in their views and advice. The SAR government is also advancing our disease control measures in order to minimize the spread of the disease and any community outbreak. In terms of inbound and outbound travel restrictions, the SAR government are collaborating with mainland authorities on the framework announced on 26th of January, and a joint effort would be committed, and at mainland BCP's temperature screening and health declaration are required for outbound travelers. If they have fever or URI symptoms, they would not be allowed to leave. We will also implement temperature screening for outbound travelers at the Hong Kong airport very soon, and more infrared or thermal imaging sensors would be installed, and relevant manpower and resources would be deployed. In terms of enhancing inbound and outbound restrictions, the DH has installed a series of measures, including health declarations, and health advice has been issued for individuals who visited Hubei in the past 14 days and those returning to Hong Kong, as well as Hong Kong residents currently in Wuhan. I would invite Dr. Constance Chan of the Department of Health to tell us more about these areas of work. The Chief Executive talked about the quarantine facilities. These facilities are important in tracing the close contacts. We must have adequate quarantine facilities in order to deal with the epidemic as a whole. Apart from the work of the DH and CHP, the HA is also committing work in different areas. The CE talked about the fees charged for non-entitled persons. In a moment, I would invite Dr. Tony Ko, Chief Executive of the HA, to talk about the latest situation at public hospitals, including the arrangements on isolation beds, as well as laboratory quick tests. And I would invite Dr. Ko to share with us the latest developments. I realize that recently a number of healthcare professionals offered recommendations and voiced their needs. If appropriate manpower and resource deployments can be made by the HA, then their staff can focus on the work in hand. And I'd like to invite Dr. Ko to talk about the relevant measures. As for the specific clinics, they are now ready, and I'd like to stress that these clinics have a very important role to play because they would help deal with suspected cases. In case of a community outbreak, we would need such clinics to offer support and to reduce the burden on A&E services. So Dr. Ko would tell us about that as well. Finally, the SAR government has always placed top priority in the well-being of citizens, so we will closely continue to monitor the development of the epidemic and consult experts. We will continue to reinforce our disease control measures as well as publicity efforts. We will provide transparent information so that the public can grasp the latest situation. Finally, I'd like to take this opportunity to thank all healthcare professionals, whether they are frontline staff at public hospitals or Department of Health staff who have worked day and night in coordinating different matters. I understand that our colleagues might have concerns and they are under tremendous stress. I'd like to tell all of you that you are not alone. The Chief Executive and the government would provide full backing in terms of including provision of resources. So at this juncture, I hope everyone would stand fast to their posts and uphold their professional spirit. I'd like to thank you all for your professional and selfless efforts. So I would invite Dr. Constance Chan, Director of Health, to tell us more about the work of the DH.
Dr. Chen, some statistics. Yesterday we didn't have any new confirmed cases. As of 4 p.m. today, we have not any additional confirmed cases. We've announced that for those for Hong Kong people who visited Hubei province for the past 14 days, when they enter back to Hong Kong, they have to get in touch with the Port Health officials. They will be screened. If they don't have any symptoms, they will be advised to wear face masks and isolate themselves for 14 days, and there will be medical surveillance on them. For other people coming back to Hong Kong within 14 days, they should try their best to stay at home. If they have to venture out, they have to wear face masks. For those who have visited Hubei province in the past 14 days and have come back to Hong Kong, they should ring the CHP hotline at 2125-1122. Is operational between 8 a.m. and 9 p.m. Dr. Tony Ko, for public hospitals, over the past 24 hours, we have seen 78 suspected cases. At noon today, there are 103 patients who are placed in isolation. For the 8 confirmed cases, they are in PMH, 7 in stable condition, 1 in serious condition. For the use of isolation facilities, at noon today, the negative pressure beds, the utilization is 34%, and for the negative pressure ward, it is 55% utilization rate. In order to make sure that we can use our resources in an effective manner, like the Secretary said a moment ago, we will step up the capacity at the laboratory. By this weekend, the laboratories at the clusters will be able to provide the rapid diagnostic tests. These tests will enable us to speed up the diagnosis of the suspected cases and see which of the reported cases should be confirmed, should be classified as confirmed cases. And we will be working in collaboration with the laboratories. For the designated clinics, we're also making preparation. Like the Secretary said, if the disease is further developing and there are a lot of cases needed for medical surveillance, for the patients that are in milder condition, we will have to have these patients screened and tested in these designated clinics in order to avoid the pressure or lighten the burden on the A&E departments. And we need to have the hardware and software. We need to have the isolation facilities and the X-ray facilities. We are grateful to our colleagues for working so hard to tackle the disease. And we will pay attention to the needs on the part of the medical staff. We will make sure that there will be enough PPEs for the healthcare workers. For manpower, we will tie in with the needs accordingly. In order to release more manpower to deal with the outbreak, we will reduce the non-urgent services like non-urgent operations so that we can have more manpower set aside to deal with the disease. For outpatient clinics, the stable patients can take advantage of the refill clinics for prescription, and this will reduce the burden on the healthcare workers and also reduce the times they have to come back for follow-up consultation. In order to enhance communication other than the usual platform that we have the apps and also the web page. Starting from tomorrow, other than the hotlines, the headquarters will be designated a 24-hour hotline, which will be operational from tomorrow. If colleagues have any requests or any needs, they can get in touch with the headquarters, and we will tie in with the needs accordingly. Secretary for Security. Regarding the entry and exit control, I have 3 points to highlight. First, on the 30th, when we suspend the BCPs, all the facilities and manpower will be diverted to other BCPs in order to make sure that these BCPs will be operating in a smooth manner and will enhance the control and prevention efforts and also the disinfection efforts. Starting from today, more Hong Kong people are making their way back to Hong Kong, and more visitors are making their way out of Hong Kong. So we will monitor the situation today and also tomorrow regarding the entry and exit situation during this peak period. And we will monitor the suspended BCPs, and we will ramp up the control and efforts in these BCPs. We will regulate the opening hours of certain BCPs in order to regulate the flow of people. Also, for the people from the Hubei province who are still in Hong Kong, we will be, after communicating with the hospitality sector, we will get in touch with these people. We will record their personal data, and the health advice leaflets from the CHP will be distributed to them and advise them to follow all these advice. Thank you. STH. The Chief Executive mentioned the the cross-boundary transport arrangement. Let me supplement for the high-speed rail Hong Kong section and the intercity through train starting from Hong Ham. Starting from the 30th, from midnight, the service will be suspended. So the through train and the high-speed rail will not be coming to Hong Kong. We have liaised with the MTRC and the national rail operator. Once the services have been suspended, the West Kowloon station will be disinfected, and depending on the situation, the West Kowloon station will be closed. For cross-boundary buses, in order to minimize the flow of people and cross-infection at certain border control points. The Hong Kong to Macau Bridge bus will have the services adjusted from January or beginning of January to end of January. The number of cross-boundary passengers has diminished, and also the Hong Kong buses will see the schedule adjusted. So people should pay attention to the schedules of the cross-boundary bus services. They should pay attention to the website of these bus companies. For aviation, we have communicated with the state aviation authority. Starting from the 30th, the flights between Hong Kong and the mainland cities will be reduced by 50%.
係同香港有關嘅航空公司進行一。
We also communicated with the relevant Hong Kong airlines, while the National Aviation Administration would communicate with their airlines. So for passengers intending to fly to or from Hong Kong, please pay attention to the arrangements. As for cross-boundary ferry services, like the Chief Executive said, at the China Ferry Terminal and Tuen Mun Ferry Terminal, and they would suspend service from the 30th of January, so all fleets would be suspended, while the Macau Ferry Terminal and Shun Tak Terminal would retain limited services. Secretary for Commerce and Economic Development. Thank you. Due to the recent epidemic on the supply of certain items, such as face masks is short, and we do understand the demand. And as such, the government has discussed the issue with the relevant trades, and we would try to see how we can overcome the difficulties in supplies. Some of the shortage might be short-lived. For instance, certain mainland manufacturers might not operate during the New Year holiday, and in that case, the shortage would be temporary. We know that some face mask manufacturers resumed operation sooner than usual in light of the situation, and we understand the supply of certain items might be tight due to the mainland situation. And for the government, we have all along been making procurements and the HA and DH would ensure the supplies for frontline staff. We would work with the relevant authorities on the procurement of batches of items. And in recent weeks, some supplies were able to arrive at Hong Kong after negotiation between customs authorities. And at recent times, millions of items arrived in Hong Kong in this manner, and we will continue our work. For supplies in demand from the public, if communication between customs authorities are needed, we are happy to play the role of middleman in order to facilitate the logistics. But since the supply of many items is tight all around the world, our efforts would not be, or our procurement efforts would not be limited to the mainland. We would procure from around the world. we will do our best to ensure a stable supply. So I call for calm from the public. I hope the public can help each other in terms of the purchase of different items. Tomorrow, I will meet representatives from various sectors as well as chambers to see how we can secure demand and smooth logistics. This is something we will discuss with the trades tomorrow. Thank you. We now proceed to the question and answer session. Please raise your hand. Please identify your organization before you speak. Please be brief so that more journalists would have the chance to ask the question. I'm from Cable TV. The measures include the XRL and intercity through train service. Why are you choosing to suspend service only 2 days later? And one of the measures include slashing the number of flights from the mainland in half. But since many experts recommend fully restricting visitors from the mainland, are you wary of the threat of spread of the disease, and how and under what circumstances would the government consider closing the borders altogether? Would you be wary of false declarations from visitors on their health conditions? What can the government and HA do in this regard? As for the question of closing our borders, perhaps Mr. Frank Chan can talk about the suspension of XRL and intercity through train service. In recent times, some people have called for closing of the borders. That means our border control points, whether it is land, sea, or air. The number of visitors arriving via land has been substantially reduced. But like I said, more than 70% of the visitors using our BCPs are Hong Kong citizens. So why would we want to restrict the travels of Hong Kong residents? Like I said, I would encourage people not to go on holidays or visit the mainland unless necessary. But the fact is there are a lot of Hong Kong residents on the mainland. So if we close the borders, doesn't mean we do not want them to come back. From a disease control perspective, for those who have visited places with an epidemic, whether they are Hong Kong residents, mainland residents, or other visitors, the risks are the same. So we should adopt a risk management approach when we deal with the BCPs. The measures we just announced would ensure that the number of BCPs, for the BCPs still in operation, we can reinforce our work. For example, requesting more detailed declarations, and that would reduce the likelihood of false declarations. And like we said, we would tackle the problem at source. The mainland authorities propose prohibiting outbound tour groups to Hong Kong, and as such, the number of visitors from the mainland went down by 20%, and new IVS endorsements will no longer be issued, and we expect the number of travelers to reduce by a further 50%. For the rest, for example, those visiting their families or business travelers, are we going to fully suspend the commutes of these travelers? If that is the case, the consequences would be grave, and Professor Leung Chok Wai said yesterday that the key is what we are going to do instead of considering whether to close the borders. And we feel that the measures we propose are more appropriate. But since the situation of the epidemic can change anytime, I cannot say whether further measures would be taken out in the future. We will close a total of 6 BCPs, and we have a total of a dozen or so. So are we going to shorten the operating hours of other BCPs? This is something the SAR government would monitor, and we would make timely decisions when necessary. I hope the public would remain objective and impartial in assessing what we are trying to fulfill. I would now hand over to Mr. Frank Chan to talk about the railway services. Thank you.
理解我
If you understand why we have to suspend the high-speed rail service, the purpose is to achieve prevention of the outbreak. Now we have taken measures regarding the Wuhan people. The flights and also the high-speed rail services have been suspended. There is no flight for them to come to Hong Kong, and the high-speed rail will not stop at Wuhan. And this has been implemented on the 24th. Now for the high-speed rail, on the 27th of January, Hong Kong-bound people, it is 11,000 people, and mainland visitors are less than 2,000. These are people outside outside Wuhan. There are so many Hong Kong people waiting to come back to Hong Kong, so they need time to get used to the suspension of the services, and other than the high-speed rail, they have to make arrangement to come back to Hong Kong. So we believe that the 30th midnight would be the appropriate time. Next, please. TVB. A moment ago, Mr. Frank Chan said that Hong Kong people staying in mainland would be allowed time to make their way back to Hong Kong. Why don't you arrange for a special train to take them back? Why don't you suspend the service tonight? Second, you may slash the flight by half, and half of the BCPs remain open. Now, the reporters came back through Shenzhen. The immigration officials raised a placard to ask whether we came back from Wuhan, and we just said no, and we were allowed in. There was no declaration form, and there was no temperature screening. The measures announced today, would they be effective enough to stop the suspected cases coming to Hong Kong? Any prevention and control measures would serve a particular purpose. I don't think any control and prevention measures will achieve 100% effectiveness. I remember Dr. or Professor Gabriel Leung explained to us. He said that it would be like a Swiss cheese, and there are holes in the cheese. As long as you have enough Swiss cheese, 10 or more layers of Swiss cheese, you can cover all the holes there. So all these measures are intended to supplement or complement one another in order to achieve the control and prevention effectiveness. The key thing is everybody should be taking part in these prevention and control endeavors. If someone has fallen ill and they have taken loads of Panadols, and it would be sometimes hard to detect them. Now, if the epidemic is escalated from a small scale to a big global scale, then everybody would be the victim. So everybody has the obligation to look after the health. The flights, Mr. Frank Chen can supplement. Your first question is about Hong Kong people stranded in Hubei. Why don't you deploy a special train to take them back? Why do you suspend the high-speed rail only on the 30th? There may be other people coming in this interim period. I thought you would talk about Hong Kong people in Wuhan. Well, you are concerned about Hong Kong people. We're just as concerned about Hong Kong people. China is a vast country of 9.6 million square kilometers, and Hong Kong people in the mainland, if there are enough numbers, the mainland officers will be happy to follow up. But when you talk about the high-speed rail, we have the short-haul route from Hong Kong to Futian, Shenzhen Bay, and Guangzhou. From the long-haul route, it goes to Shanghai, Beijing as a destination, or Hangzhou to the east, and Kunming to the west. So the coverage is so extensive. And Hong Kong people may be visiting their relatives, and they may be in the mainland on business. There are so many different routes for them to use. And also, we suspend the high-speed rail. Why not tonight? I have already answered this. I'm not going to repeat myself. Now, in terms of disease control, if we can minimize the flow of people, if we can minimize the context, the suspension of the high-speed rail is one of the measures. Like Chief Executive said, and also Professor Sophia Chan and Director Chan and Dr. Koh said, everybody has to take enough precaution and look after themselves well enough when they are out and about in order to avoid infection. I don't think one single measure would be the panacea to the problem. We need to have all these various measures taken together to enable us to successfully deal with the outbreak. Lady in white. I'm from Mingpao Daily. You mentioned all these measures taken together. Will the government anticipate the level of the number of people traveling to and fro? How many are Hong Kong people? How many mainland people? Professor Gabriel Leung said, other than Wuhan, there are a number of major cities that are likely to become infected cities like Chongqing and Shenzhen, Guangzhou, which are closer to Hong Kong. Will the government consider taking reference from the Hubei example and impose similar control on people coming from mainland people coming from other places? Second, in terms of capacity, you have the quarantine facilities. How many people can you accommodate? If the number exceeds the capacity, what other measures do you have? What are the sites that you have in mind to accommodate these people? For the first question, I defer to the Immigration or the Secretary for Security. Let me say this first. All these measures will make it more inconvenient. The suspension of the BCPs, it will make it inconvenient. If we stop the sea route, they can use the land route. It would be hard for us to specifically assess the situation, but from the experts, if we make it sufficiently inconvenient, it is likely that the number of people will diminish. Over the past month, as the Secretary for Security alluded to, the number has been diminishing. The Secretary and the Director might wish to supplement later. The second issue, as I said, to tackle the disease, we have to monitor the situation and make resolute response. We have seen community outbreak in Wuhan in Hubei province, Macau has also adopted very stringent measures. There are not many places the world over that adopting these stringent measures. Because of the sheer number of people, we have decided to adopt these stringent measures. And every time we adopt stringent measures, we have to assess the effectiveness and also the resulting implications. And for the time being, we don't have any intention to extend these control measures to other cities in the mainland. TMH and also the 3 quarantine centers capacity there. Chief Executive, if I may address the issue raised by the reporter, and then I defer to Dr. Koh and Dr. Chen to say something about the quarantine centers and all these other facilities.
整體都已經係大幅咁樣咧，係去管制。
We have installed substantial measures to restrict the number of visitors, and like Dr. Constance Chen said, we have other border measures, including health screening and health declaration. And we have also issued specific health advice on people who have visited Hubei province in the past 14 days, or those who have visited Hong Kong from other provinces through other provinces. These enable us to understand their health conditions more readily. For those returning to Hong Kong from the mainland, they should seek to stay at home for at least 14 days, and if they have to go out, they should wear face masks. For those who have visited Hubei within 14 days and have since returned to Hong Kong, the CHP has introduced a hotline 2125-1122 to answer inquiries and offer health advice and information on follow-up work. As of now, the Lady MacLeod's holiday home has been in operation since the 23rd of January, and there are 45 units. As of 7 p.m. on the 26th, 18 units had been deployed, and Lei Yu Moon Park Holiday Camp has been ready from the 25th of January. It has 27 units. At Pak Tam Chung Holiday Camp, it is in the final stage of preparation, and it can provide 18 units when necessary. As for the isolation beds at Princess Margaret Hospital, there are 8 confirmed cases currently, and our response plan states that the first 20 cases would be dealt with at PMH. If there are more cases, the remaining cases would be dealt with by the 6 clusters, and if we see more cases, we would activate other facilities with negative pressure wards and isolation beds, and deployments would be made based on the developments, and the facilities will be ready when called upon. We talked about the inbound and outbound travel restrictions and the repercussions, and the suspension of the endorsements involved 49 cities, and based on past statistics, IVS travelers made up 50% of all the inbound visit endorsements. So based on past statistics, 50% of the inbound travelers would be affected. As for the restriction on visitors from Hubei, we believe we will see a few hundred less visitors every day from Hubei. I will now defer to the Director of Immigration. Thank you. In light of the recent epidemic, the number of visitors has dropped significantly in recent times. In January, the number of inbound and outbound visitors dropped by 50% compared with the beginning of this month. As for the number of mainland visitors visiting Hong Kong, it went down by 2/3 with our new measures, including suspension of the IVS endorsements and the suspension of POTS, or BCPs. The drop will become even more significant. As for the capacity at the 3 quarantine facilities, even though only a few dozen units are provided at each facility, we are exploring the possibility of in situ expansion of these facilities, since the space is there and we can quickly complete the construction. How many such facilities are available? Since there is not much objection towards the use of these facilities for quarantine, we will try to maximize their use.
Lady here.
Blake Essex, CNN. Chief Executive, you said that public safety is your primary concern, yet when you laid out your measures that you're taking, they sound only like half measures. Are you putting Hong Kongers' lives at risk by not closing the border?
I have explained at length what do we mean by closing the border. Hong Kong has at least 14 border control points for various passenger flows between Hong Kong and overseas, as well as the mainland. And as I have demonstrated with some of the figures, 75% of the passenger flow through the control points, at least up to the 27th of January, were Hong Kong people. So closing these control points means that we do not allow Hong Kong people to come back. There are a large number of Hong Kong residents who are now traveling in the mainland and overseas, and they need to come back. So I don't think it is very meaningful to talk about a complete closure of the border control points. The strategy that we have laid out this afternoon is to try to drastically limit population mobility, especially between Hong Kong and the mainland of China, through various measures. I try to repeat in a very precise form. One is, of course, at the source of these approvals to come in. So we are saying that with the full support of the central government, they have agreed in principle to cease issuing this IVS, Individual Visitors Scheme permits. So that will take away 50% of the usual mainland visitors coming to Hong Kong, together with the 20+ percentage points attributed to group tours from the mainland. We will have removed a large chunk of the source of mainland visitors coming to Hong Kong. The rest will be quite legitimate for business purpose. I'm sure you know there are a lot of businesses between Hong Kong and the mainland, and for visiting relatives or even in carrying visitors to visit them in hospitals. These are very legitimate and humanitarian reasons for people to cross the border. Another measure is really to reduce or to consolidate the number of border control points. In one go, we are seizing the service for passengers in 6 control points. That's quite a drastic measure. So that, again, will hopefully reduce passenger flow and achieve the outcome of drastically limiting the people or the population mobility between the two places. So I wouldn't agree that these are really minor, non-important issues for us to tackle the current virus situation. And you must also bear in mind that from yesterday onwards, we have also imposed a very stringent, if not draconian, measure of disallowing people from Hubei province to come in. Either they are Hubei residents or they are people of all nationalities except Hong Kong people, except Hong Kong residents who have been in Hubei province for the last 14 days. And I don't think many parts of the world have adopted that very stringent measure.
回答多一條英文問題之後，翻去中。
One more English question, please.
Happy New Year, Mrs. Lam. This is Alvin from the South China Morning Post. I have 3 questions. The largest pro-establishment party, the DAB, expressed that it does not oppose to the closing of the border. And given mainland visitors have accounted for about 20 to 30% as of latest situations, are you still categorically ruling out the closing of the border? And in case the situation worsens in the neighboring provinces, for instance, in Guangdong or Jiangsu, would you consider partially closing down or strengthening the restrictions on these cities? I mean, when the situation comes to community outbreak. The second question is, you mentioned about there's a sizable number of Hubei residents already still in Hong Kong. Could you give us an idea of how many are them? Are they thousands or tens of thousands of them? Thirdly, a question for Secretary Mr. Yao. You mentioned about the global procurement of masks, but because Professor Gabriel Lam mentioned about the outbreak of the virus could peak in about late April or early May. I mean, how much pressure is that on the supplies of these masks, as well as could you share about in what circumstances would the government perhaps resell or balance these supplies in the private markets if the situation is very intense? Thank you.
Thank you. On the first question, I have said on a previous occasion that the only consideration of the Hong Kong SAR government in dealing with this novel coronavirus infection is public health. Public health underpinned by very strong scientific and expert advice. There is no other factor involved, okay? So whether a particular political party has a certain wish or aspiration does not come into our consideration. And I hope all political parties in Hong Kong will support the SAR government in taking that very scientific and public health-oriented approach and join hands with us in dealing with this public health crisis. I have explained at length that the meaning of so-called complete closure of the border control points is not meaningful. It's very difficult to understand because there are such a large number of Hong Kong people traveling between these places, whether between Hong Kong mainland or Hong Kong and other places. So to stop all passenger traffic on such a massive and comprehensive scale is not warranted. But what we have done is more or less what you have described. You said that what about partial closing down? I'm now suspending the service at 6 border control points. So you can also describe that as a partial closing down, although I would rather say that we are doing some sort of consolidation in order to reduce the population mobility and also to enable us to concentrate the manpower to do a much better and enhanced medical surveillance and inspection job at the border control points. But, as I said, the situation is evolving and changing very rapidly, okay? So if you asked me a week ago, I perhaps would not have that determination to put in place some of the measures that we have put in place yesterday and today. So we will continue. We will continue to closely monitor the situation, both locally and in the mainland and maybe even internationally, and take the necessary and decisive actions to protect Hong Kong people's health. As far as the number of Hubei residents who have entered Hong Kong prior to yesterday when the ban took effect, Unfortunately, in our usual sort of immigration system, we did not capture that statistics. But if anything is to go by, we only allow them to come in for 7 days. And according to American immigration, yesterday we denied entry of above 300 plus. So if you make that assumption, and people will have left either back to the mainland or back or to another, using Hong Kong as a transit to other places, then the number would not be in the range of the tens of thousands that you have mentioned. Certainly not of that magnitude. About the
Okay. Regarding the supply of masks and other protective gear, we understand, well, in this sort of situation, well, they are heavily sought after locally, across the boundary, and also globally. So the focus is we try to tackle in this entire supply chain, that production, supplies, logistics, and also distribution. Now, on the production side, we know that, well, the major production might be across the boundary in the mainland. So we have proposed certain of them. And actually, well, some actually sort of come back to resume the production. But there were also sort of circumstances we saw that, well, there might be sort of a custom facilitation, which we stand and have been standing ready to help. So through our sort of custom-to-custom cooperation and also discussion with the mainland authority, we succeed in sort of facilitating some consignment coming back to Hong Kong. But at the same time, we'll continue to sort of procure in the light of the demand locally. But as far as government is concerned, our priority is to ensure adequate supply to medical professionals, including hospital authority and also health department. This will form the bulk of our sort of demand, and that's why we are saying that we'll go for direct purchase, and also we are sort of tendering out sort of on a global basis to source more. And in fact, that's why I said, well, our overseas offices are also helping in sort of widening the net. Of course, we also need to talk to local sort of retail sectors on the distribution. Now, hopefully, well, after this long holiday, more retail outlets resume, and therefore, if they are stocked, then they can sell. But at the same time, I think we believe that, well, suppliers, if they encounter the same problem that government encounter, we are also happy to help them. We are obtaining sort of information on a consignment basis. If that would require same custom facilitation, we'll do the same as we did in the last 2 weeks to help them to facilitate. But I'll be touching base with the wider retail sector to see how much more government can help and also to work together with them along this line. Thank you.
最後兩位。
Last 2 questions. Gentleman in front. Mrs. Lam, Hong Kong 01. About the BCPs, the Director of Immigration said earlier on that mainlanders coming to Hong Kong, the number has been reduced by 2/3. With the introduction of new measures, there will be a reduction of 50%. There were 28,000 people who have come to Hong Kong at the height of the outbreak. By slashing half, we may end up with 10,000 or less than 10,000. Will there be enough to assuage the concerns of Hong Kong people? You're looking at the immigration figures, those coming in through the airport, number is 10,000. You are slashing the flights by half. By implication, there are 5,000 mainland visitors coming to Hong Kong by flight through the airport. How can you ensure that we can stop the flow into Hong Kong from the mainland? There are a lot of political parties who are raising the prospect of complete border closure. The DAB did not have any objection to that. The Liberal Party chief, Mr. Zhong, also did not object to that. Mrs. Lam, how do you react to these political parties? You said that we should look at the issue in an objective manner. Are you saying that these political parties are not sufficiently objective? Also, Five-Ming Estate, this has caused vehement objection and confrontation from defending residents. You said the fire-being estate will not be used anymore. Your decision to not use fire-being estate, is it because it has been damaged, or is it because you have listened to public views, in particular the views advanced to you by Mr. Edward Lau, or is it just because the facilities have been damaged? All right, leave more time to your colleagues, please. In answer to your first question, let me say this. First of all, there is no one single measure that will achieve the effect of disease prevention and control. We have to adopt a multi-pronged approach. So by limiting the number of people between the two places, we do have other measures. We can make the immigration surveillance more stringent. According to the usual practice, we are regulating the inflow because they are likely to bring in the disease. Now we are also regulating the outflow. We are going to adopt the joint efforts for control and prevention together with the Guangdong province. So Shenzhen has implemented the temperature screening and the health declaration. If people are febrile, and they will not be allowed into Hong Kong.
有關嘅當局咧係有一啲嘅即係安排，我哋會
We cannot bar them from coming back, and as such, there would be an arrangement on the reception of such visitors. So, in terms of disease prevention work, we must look at the big picture instead of just focusing on specific measures. When we deal with the epidemic, we hope things would not be made political. I hope political parties would be pragmatic in addressing the issue. Many people might have different views, but as we have explained on what closing the borders mean and what we intend to achieve by limiting the flow of visitors, I hope you would understand and accept the arrangements. As for the Fire-Ming estate incident, in the past, for instance, when dealing with SARS in 2003, it was also part of the response plan. Even though I wasn't at the front lines back then, as Director of Social Welfare, I was involved in disease control work, including deploying social and welfare facilities, for example, boys and girls homes for quarantine purposes. Those were children of patients who were admitted due to SARS. And the SWD had to identify welfare facilities for quarantine purposes. At that time, the society accepted that more quarantine centers were warranted. But 17 years on, our society might have changed. Even though we are just acting in accordance with the response plan by identifying a housing estate, of course, the residents there might not find the move appropriate. It was a decision we made after assessing different options. Eventually, we ditched the proposal. If the facility or estate was not subject to the serious vandalism, we would try to convince people, and we would have taken in views and comments to try to resurrect the use of this facility, since the estate or the facility can provide up to 900 units. But since it was subject to serious vandalism, the damage was beyond what we could see with our eyes, and it could take up to half a year to restore the facility. So I'm infuriated by the acts of these black-clad rioters, and I strongly condemn them. arrests were made by the police, we would continue to investigate the matter to put those in justice. But given the serious damage, I hope the epidemic would disappear in 6 months' time. By early summer, we should see a regression in the epidemic. We wanted to use the facility, but it wasn't possible. It is not that we would just follow whatever people say when they didn't want us to use certain facilities. I'm from the Hong Kong Economic Times. You said no new endorsements would be issued, but what about those who already secured endorsements? If they could still visit Hong Kong, then would it be conducive to disease control? The CE said no measure is 100% effective. Why don't you prohibit all non-Hong Kong mainland visitors from visiting Hong Kong? And would that achieve a better result? As for the staff member in the Wuhan ETO, I'd like to know what his health conditions are. The government said they do not know the number of Hong Kong people in Wuhan. Is it possible to trace them, or those who are from Wuhan but still in Hong Kong? Could they be repatriated? For the first question, I stress that the measures we adopted yesterday were stringent and unprecedented. Even though there is widespread concern on the epidemic and that there were cases in many different countries and cities, none of them barred Chinese visitors or mainland visitors in our case. Like Macau, we have adopted stringent measures, and if further measures are to be adopted, they must be done on reason and scientific evidence. Like Professor Yuen Kwok Yung said, he's not against the measures, but we must think about the cost. If no mainland visitor is allowed to set foot in Hong Kong starting tomorrow, you could see what would happen. So we are trying to conduct disease control. We would refrain from adopting extreme measures. If some people want to enter Hong Kong at whatever cost, it would not be possible to trace the whereabouts of that individual. The second question was about the member of staff at the Wuhan office. As I understand, they are in good shape. They could not go out due to a lack of transport services, but they are still having their meals as normal, and they are maintaining communication with Hong Kong people that require assistance by phone or Weixin. And we are discussing with the central government on how these people can come back to Hong Kong. As for Wuhan people in Hong Kong, like I said, we would get in touch with them via different means. If they are tourists, they might be staying in hospitals. For students, they might be in our universities. So we would touch base with them and refer the cases to the CHP, and hopefully, and with the hope of providing appropriate health advice. If we find that Wuhan residents still staying in Hong Kong warrant further treatment, they would be referred to HA hospitals. This is the end of the press conference. Thank you. Finally, the measures we just announced today would inevitably bring inconvenience to people who are prepared to come back to Hong Kong, I call for understanding on this, but I stress that this is an essential part of our disease control work.